Hi, my name is Alexandra Carmichael, and my presentation will be on generalized anxiety disorder. This is a peer-reviewed journal article by Peter Tyler and David Baldwin from The Lancet with an impact factor of 59.1. So the abstract. Generalized anxiety disorder is a disorder that affects both men and women, with women being the primary gender affected with the disorder. This disorder comes with many symptoms, including difficulty sleeping, eating, body aches and pains, and palpitations. The symptoms listed also overlap with a large amount of common mental disorders, and this creates a spectrum of disorders related directly with each other. Here's some effects on the body with generalized anxiety disorder. Um, in the brain, there are persistent worries, intrusive thoughts, excessive planning, difficulty making decisions, difficulty concentrating, the inability to relax, and an overwhelming sense of uncertainty. In the stomach, there is nausea and diarrhea. You also tend to have frequent urination when it comes to anxiety disorder. And in the heart, you're easily startled and you have heart palpitations. Introduction. Generalized anxiety disorder is considered a comparatively new disorder, considering it was only diagnosed recently. In 1894, Sigmund Freud portrayed this disorder as a persistent feeling of unattached fearfulness, described as a free-floating anxiety. This disorder was placed under the label of anxiety neurosis, which was disagreeable because this label included panic, and panic was not a symptom of anxiety neurosis. This led for the classification of generalized anxiety disorder. The fact that there are so many features of this disorder made it hard to diagnose because of the comorbidity of the disorder. Today, generalized anxiety disorder is accepted by epidemiologists and clinical psychopharmacologists, but clinicians are still pretty reluctant about this disorder. Clinicians believe that generalized anxiety disorder is an ill-defined diagnosis, and this claim supports the comorbidity that generalized anxiety has with so many other common mental disorders. Methods and materials. Methods. To diagnose this mental disorder, one symptoms would have to be stated in the WHO's International Statistical Classification of Diseases and Related Health Problems, 10th revision criteria. At least one symptom of autonomic arousal is required for the diagnosis. Materials. The requirements of this diagnosis include excessive anxiety and worry, which is, apprehensive expectation about a number of events or activities, and also a combination of various psychological and somatic complaints. The diagnosis of generalized anxiety disorder, according to the ICD-10, is tensions, worries, and fears about everyday events and problems for at least 6 months, with the following symptoms. Again, vegetative manifestations such as increased heart rate, tremors or dry mouths, symptoms in the chest or abdomen. Mental symptoms can include dizziness, derealization, fear of losing control, fear of dying, even though when there is no threat to the human body. General symptoms include hot or cold flashes. Some other non-specific symptoms are exaggerated startle response, lack of concentration, irritability, and difficulty falling asleep. And with this being said, everyone is different. You may or may not be affected by these, or you may be affected by these or others. Some symptoms of tension include muscle tension, agitation, foreign body sensation in the throat. So people who are affected with anxiety, generalized anxiety disorder, are tormented by constant worries, and the worries include that them or their loved ones might become ill or die. And activities that are perceived as dangerous or that are usually not dangerous are avoided or postponed. And patients also worry about the fact that they're always worrying, even though there seems to be nothing to worry about, but they can't help but worry. Psychological therapies are seen to be preferred over drug treatments, but these cannot be conducted because people cannot afford these methods or even have access to them. However, there is no study or evidence that suggests drugs are more effective than psychological treatment and vice versa. Most doctors in Western countries are likely to prescribe drugs instead of referring to treatment, regardless of what the patient may prefer, because some patients may prefer to go to therapy or some may prefer even to have drugs. But this is not really taken into account when speaking of forms of treatment for generalized anxiety disorder. Results and discussions. After receiving the proper diagnosis, the next step is treatment. Generalized anxiety disorder patients can be treated with cognitive behavior-based therapy, dynamic therapy, anxiety management training, and drug treatment, which is what we just were referring to. Some discussions that are had about generalized anxiety disorder that since the 1980s, many placebo controlled trials have been conducted to study the effectiveness of certain treatments for generalized anxiety disorder. In these trials, it was determined that both short-term and medium-term drugs were effective. Studies show that antidepressants used in major depressive disorder have a high effectiveness in treating generalized anxiety disorder. This shows the comorbidity between these two mental disorders. And here I just have a picture showing the overlapping symptoms of major depressive disorder and generalized anxiety disorder. They include anxiety, sleep disturbance, psychomotor agitation, concentration difficulty, irritability, and fatigue. Cognitive therapy was seen as the most effective form of the psychological therapies. And this can be dynamic therapy or anxiety management training and stuff like that. So limitations and future directions. So self-help. Self-help, sometimes the pharmacological and psychological approaches to treatment do not help the patient treat their anxiety. When these treatments do not seem to make any progress, the patient can take a self-help approach, which is a more natural and convenient remedy. A series of controlled trials supported the idea that self-help approaches to generalized anxiety disorder treatment are indeed effective and are most effective when the patient is giving a guide to self-help approaches, which is a bibliotherapy. And a bibliotherapy is an efficacy of self-help manuals for anxiety disorders and primary care. Prevention. Studies show that there is a very high relationship between generalized anxiety disorder and the personality trait neuroticism, which shows how genes can play a large role in the diagnosis of generalized anxiety disorder. So, for example, if you have a parent who has generalized anxiety disorder, you are probably likely to be diagnosed with it as well. When it comes to generalized anxiety disorder, prevention can include joining psychoeducational community groups to discuss intervention methods for generalized anxiety disorder. And these are usually very accessible to the patients, rather than having therapy that may be too expensive for people to afford. So these groups are maybe a more cheaper way of dealing with anxiety. Receiving help at an earlier time can also help with preventing the long-term effects of anxiety, because people are more likely to be diagnosed in their later years of life. The most common age for diagnosis is age 40 to 65, and that's when people are typically diagnosed with anxiety disorder, even though they may have had symptoms way before that. So receiving help at an earlier time and reaching out can help you in the long-term effects of dealing with anxiety.